could maybe confirm also. We went to Gulu Regional Referral Hospital. We were in a view that mosquito nets were delivered throughout the country. Gulu actually said that they did not receive mosquito nets that were distributed this year. I think that's what they told us, Chair. Chair, you are with us. We even were so surprised. Actually, it was the ED. Yes, because the regional referral hospital takes care of the city and the district. So we went to the regional referral hospital and they presented to us the report of the entire city and the district. And we saw there was an increase in mosquito in malaria. When we asked that, did you receive? And they said they did not receive, Gulu district did not receive mosquito nets. We were there. And we were so surprised about that. We actually we asked them 2 times and their answer was, did Gulu district never received mosquito nets?
Chair, just one.
You know, we have to continue with our report writing.
Yes,
Honorable Chair, I had a small comment before the Minister.
The report for the group presentation, and they want it today. Colleagues, it's my humble request. We can call this Minister another day, because there are so many issues we want her to address. Please, maybe you can ask it, just 1 second.
The entire country received nets in the mass distribution, and similarly, all facilities receive nets for pregnant women and children. What is true is that northern Uganda has more malaria than any other region, for the fact that Anopheles gambiae is seasonal. Anopheles funestus, which covers northern Uganda as well, is perennial throughout the year. So they will still have malaria, but they should not tell a lie that they didn't receive a net. Chair, the issue of 150 for imaging for CT scans, that's CT scan is sub 700, 800, 1 million. We need to service the machines. Asked for money for servicing. To date, I have not received any money. Now, to avoid the machines getting spoiled and not being serviced, we sat down and we agreed, can we collect a nominal fee to service the machines? So we are not going to run out. 150 is too little. It's not even servicing the machines. The dialysis machines need servicing. We are not getting any money for servicing. So are we going to sit back and allow the machines to get spoiled? No. So we discussed and the PS put it in writing following a senior top decision. We actually should increase this to about 300,000 because it is not going to work. But 50 is what we agreed on, Chair. Dental consumables. First of all, it is very wrong for those dental officers to go with their equipment to use our facilities. They should be using it in their private facilities, not in ours, because they come there to use our dental chairs. It is not true that NMS does not supply dental consumables. NMS does. They use those consumables and charge patients. In all facilities, they do charge patients. So we just need to find a way of addressing that. One, we must remove dual employment. Work here, work there. And then address the other aspect that I mentioned earlier.
So, thank you, Honorable Minister, for your response. You are doing a very good job. And my colleagues, you have had the responses, and this country is ours. We want to provide the best, but of course resources are so limited. So, Honorable Minister and the General Manager, we shall keep on engaging you. So when you get a call from the chairman, don't get this man calling me, because sometimes because of pressures from the communities. So please, I request that Honorable Minister with your staff, the General Manager and others, please let us work together. Anytime I call you, don't start saying that this man is calling me this time and again. But of course, because we want to provide the best to our people. My colleagues, some of these issues, we may interact with the ministry here, but there are some which you can be able to address at our constituency level. These hospitals are in our constituency, their centers. If something is going wrong, you can be able to interact with the medical superintendent, with the director, with health workers. Because sometimes, as we mentioned, that some drugs are delivered and they take long in the stores. These are issues you can be able to handle at our facility levels. You interact with they have meetings, like the hospital have meetings. You can even cause a meeting to meet health workers in your constituents. I mean, in your regional hospital, district hospitals, they will accept. Because from what I assured the director of the hospital, that is the acting, in case anything, please, if you want to meet, call me. I can be able to address some of those issues. We can be able to handle them, other than going to the ministry and going to the State House and all that. So, with brief remarks, I would like to thank all of you. You're writing a report for the group presentation. That's how I've tried to rush you. I thought it would take something like an hour, but it's taken 2 hours. So you're going to, members, when this team go, don't leave this room up to midnight today, because we have to finish and upload. Then you can go and rest. You can go for their weekends. I'd like to close this meeting officially. Thank you.
Has records. But the challenge is that the people who go to the facilities, they go there without going through NMS. So they go and listen to what the facilities are telling them without referring to the records that NMS has. There is no medicine or medical supply that we deliver to any facility in the country when it has not been asked for in writing. We don't get orders on a telephone call. We get them in writing from each and every facility. And whether they are ARVs, we get them in writing. Number two is that when NMS delivers, it does not deliver through post office. It delivers these items physically. They are received by the health facility. There is no way a health facility would receive what they don't need, because we deliver them physically. So they would only receive what they have asked for and return to the person who has delivered what they have not. So for somebody to receive what they say they have not asked for, and keep it until when it expires, that would be irresponsible. So our take as NMS is, one, it is not true that NMS delivers what people don't need. As a policy, we don't have that policy, and we keep saying that if for any reason you ordered for something, but by the time we deliver it, maybe anything has changed and you don't need it, you still have an option of returning it back to us, because there is some other Ugandan who needs it in another part of the country, rather than keeping it and you only call us when it has expired.
And finally, what do you mean by lack of last mile accountability?
Accountability, as the minister was saying, is that NMS delivers medicines to the facility, but we do not know which patient picks it. So what we want is that now there is computer systems that enable somebody to know who has actually received, which patient received the medicine NMS delivered to that facility. So what we have been asking government to do, and they are in advanced stages of doing, is to ensure that now they have that computer system at each and every facility, health facility, and that system connects with the NMS, so that if we have given you 1,000 mama kits, we know how many mothers received those 1,000 mama kits, and we can account for each of the mama kits that you receive. That is what we mean by the last mile accountability. The moment that one is done, this issue and the lies that people have been saying will come to a stop. And that is the only way that as Ugandans will start getting better accountability for the taxes that we pay.
And finally, what is
the current funding gap as determined this financial year is at about 181 billion for the medicines, but and we keep saying that we are grateful to government that for the first time this financial year is the year when government gave us the biggest increase in the budget of the facilities by increasing on the last year's budget 139 billion. So now we believe that if this increase is maintained in the next financial year, we will be close to closing that funding gap in the subsequent years.
The biggest problem has been with stockouts. No medicine in health facilities. That has been the problem with almost every community. And the biggest problem, the biggest cause of that problem has been Ministry of Finance. It has not been releasing money for logistical support of NMS. So it has been very unfortunate for a child under the age of 5 to succumb to malaria and die in a village, say in Lango sub-region, or in Hoima, or in Teso, or in Busoga, when the drug that should have saved the life of that child is actually on the shelves in Entebbe, in national medical stores. And the reason why that drug is not in the facility where it should be is that money for logistical support to fuel the truck that transports that drug to that health facility has not been released by Ministry of Finance. So that has been the problem. Now we've talked to the minister and we've been demanding that money for logistical support of national medical stores be front-loaded. It should have actually been better if that money was released at once. The entire budget to run them for a year, the entire logistical support budget to run them for a year should have been released at once, so that they now start running and supplying this medicine timely. So for this particular year, being the very first year that they've honored that request, Ministry of Finance released the money in time. It front-loaded money for logistical support, and NMS has supplied almost everywhere in time. So we are seeing NMS that is starting to work the way we wish it to work. So what we are doing is actually to monitor and see whether this intervention we've demanded the Ministry of Finance to fulfill, whether it's yielding to the extent we expect it to. So we are now making observations. So let's see in the next 6 months how we run. In regard to mosquito nets, it is indeed true. While in Gulu, we were informed by the hospital director that they never received the mosquito nets. So we got clarification from the Minister of Health, and she stated that she supplied the mosquito nets to Gulu, and she has documents attesting the same. So what we believe is that government, central government normally communicates with local government, so probably these nets were given to the accounting officer in the various local government. Maybe for Gulu it was the town clerk, and maybe for Gulu district it was the cow, and perhaps it is now these accounting officers in the local governments who didn't supply nets to the hospital. So that we shall establish the facts. But for the clarification we've got, and in the report we are going to make observations as they are. So still the hospital didn't get nets, but the particular person who is responsible for that is what we are yet to establish.
Okay, thank you very much. I'm Isaac Otimgiu, MP Padere County. Yes, the Committee of Health actually traversed northern Uganda. We had a team which went to Karamoja, another team went to Gulu, and then also another team went to West Nile. We had a number of issues that we found on the ground. Especially what mainly shocked us was that there are a number of districts, especially Gulu City and Gulu District. We were informed by the director that they did not receive mosquito nets. We are more than aware that mosquito nets were actually distributed throughout the entire country. So we are very surprised on that matter, and we today raised it with the Ministry of Health. The Ministry of Health was shocked by herself, shocked as on that. She's going to take a thorough investigation into the matter. NMS director was also here. The NMS reiterated that actually mosquito nets were distributed to Gulu City and Gulu District. So that is a matter which we are going to have a look at. But upon that as well, we have found in most of the hospitals, there is lack of space, especially for storage, in terms of medicines which are being delivered. We are mostly aware that NMS was behind in terms of delivery, so they are front-loading in some of the cycles which were not delivered last year, like cycle 5 and 6 are being delivered with some of the cycles for this year. And with that, some of the hospitals are actually struggling with hospital spaces, and this is leading to theft of medicines, since now a number of medicines are in their respective stores. But we're also happy to learn that National Medical Store finally received the operational funds. We have been pushing this through the Ministry of Finance that they get the operational funds by 1st of July so that they can start distribution of their medicines on time. And NMS has confirmed to us that Ministry of Finance now gave them the money for operations which involve transportation of those medicines. Those has been given, and we are sure that this year delivery will be done on time in most of the health facilities.
Of the key stakeholders, the Ministry of Health and the National Medical Stores, where there has been an outcry of drug shortages in our facilities. Of course, when you go to oversight, that has been the main complaint. But of course, I had to call this the National Medical Stores and the Ministry of Health and with the committees and forge a way forward to see where is the problem. But of course, there has been a problem with the budget. The budget which are getting still small. Much as of now, there has been an increment, but there used to be a problem of, the way the government disperses funds, especially in the first quarter, using the IFME system. There was always a delay. So we convinced Minister of Finance, at least for the operational cost for the first quarter, not to use the IFME system, which is being done. And of course, because of that, there has been a backlog of cycles not being delivered when they are supposed to be. There has been a delay in delivering the drugs as per the schedule. But when the front loading is being done for the operational costs for the delivery of the drugs, and now the procurement is being done and there's good quantification, I think the National Medical Stores General Manager has assured us that things are going to improve. Of course, we have to make sure that to facilitate the processes. But also, another thing is, the hospital managers, the directors of hospital, in charge of health facilities, they make what they call procurement plan. Sometimes some drugs are not put in the procurement plan. And what happens, they request for them when they are not in the procurement plan. And of course, the government can provide, it can't say 100%, but there are some other very unique drugs which it may not be able to provide. But we are trying to make sure that we increase the budget for the drugs. But still, we have to the communities. Let's try to look at prevention. How do we prevent ourselves from falling sick? You have to eat very well. You have to go for immunization for those other children which are in that age group. You have to do exercise and so many other things. Because when you fall sick, it becomes expensive. If you have a mosquito net, use it. So that you prevent yourself from falling sick. You go there to measure your BP or what, If you can do that, you can be able to reduce the number of times you go to the hospital. Consumption of drugs becomes small. And also, which I wanted to mention, this one goes to my tech doctors, the nurses, clinical officers. Let us try to avoid what they call the polypharmacy. A person who comes, you give him a set of about 9 types of drugs, 3 types of drugs in big quantities. Let's try to follow the clinical guidelines. If someone has malaria, what do you give? If someone has diarrhea, how do you give? Sometimes these patients come to the hospitals when they are stressed. Sometimes you have to cancel. To cancel, you might have problems. You present with headache, with fever. But when you try to cancel, you find that this one has the social problem somewhere, and it goes on. You don't have to go with drugs. I've ever done it. You cancel patients, and now he's not here. You don't need a drug. When it comes to the lab, let us be very ethical. You find like in some labs, whoever comes has brucellosis, and typhoid when it's not. At the end of the day, they consume a lot of drugs. So we, the technical people, the clinical office, the health workers, the clinical officers, doctors, lab, let us try to be ethical and try to follow the guidelines. When we do that, shall we be able to reduce the consumption of drugs in our facilities. But according to me, that must have been a lie. But of course, they won't find out the truth. But what I know, they must have received the mosquito nets. That could have been a lie. Maybe somebody was misquoted, but they're going to find out to give the truth. But what I know, they got the drug.